Hi, my name is Chelsea Shore, and I'm a doctoral student in higher educational leadership and policy studies in the College of Education at Florida State University. I identify as a person in recovery and currently serve as the graduate assistant for collegiate recovery programs on campus. This is my keynote speech delivered at the 2021 Collegiate Recovery Conference. Shortly after turning 21, I was pulled over and convicted of drunk driving. This was one of the few times I drank responsibly and drove under the legal limit. At this age, I also suffered from debilitating anxiety, and when I was pulled over, I experienced a panic attack. Unable to take my medication, this exacerbated the alcohol content in my blood, so when I arrived at the police station nearly 15 minutes away, I blew well over the legal limit. While I did not deserve it this time, it was a desperate lesson I needed. I am not here to excuse or justify my actions to a Zoom room full of strangers, though. I am here to use my story as a platform to advocate change. Part of my sentencing included 12 alcohol intervention meetings, a fancy name for AA. The experience was far from my own. Stories were shared about people losing everything and still working to get their life together. Even though not all AA meetings are created equal, this experience was so far away from resonating with me that it further encouraged me to engage with substance use in a more reckless manner, making a greater effort to push the boundaries of risk versus reward. It wasn't until nearly 4 years later, when I found the sport of competitive bodybuilding, that I was forced to reconcile with the fact that substance use had become my preferred coping mechanism. Substance use, addiction, and recovery exist on a spectrum, and if those of us in this room at this conference seek to address every part of that spectrum, then it is time to broaden our scope of prevention, intervention, and recovery support, specifically amongst the college student population. The field of collegiate recovery as an academic discipline is relatively young, with many growing pains yet to overcome. The field must take seriously its distinctive aspects if it is to position itself as a distinctive discipline in academia. One necessary task includes discerning the degree to which theories borrowed from mainstream addiction science are apt descriptors of the phenomena in a collegiate setting, and whether insights derived from mainstream recovery research on adult populations are adequately applicable in collegiate contexts. Dr. Nora Volkow, director of the National Institute of Drug Abuse, identified the failure of dissemination and adoption of effective interventions that actually improve the lives of individuals, families, and communities as a frustrating bench to bedside gap, especially at the collegiate level, that persists in our parent field of substance abuse and especially among typically aged college students. I once was a doctoral student in the field of sport management, also a young and developing discipline, where I was required to read through a series of prestigious Ziegler Award lectures, typically regarding the state of the field. While I am no longer in the field of sport management, much of the discourse surrounding the development of their discipline is transferable to collegiate recovery and is applicably summarized as follows. First, a present challenge in our field is whether research conducted should be practitioner or academically oriented. Second, as a developing discipline, should we be more concerned with the quality or quantity of this research? Whatever the answer to these challenges, we must remain open ended in our approach to understanding the phenomena of collegiate recovery. In the 2005 Ziegler Award lecture, Carla Costa posed a paradigmatic discussion and debate I find relevant to these concerns within the field of collegiate recovery. They defined a paradigm as a lens through which we see the world. It has the power to shape, define, and dominate academic discourse through its deeply rooted assumptions and values. We typically inherit these ways of thinking and the values associated with them without fully realizing that we can choose to live by alternative ones. In order for that to occur, there must be a shift in the dominant paradigm, which in turn requires the creation of one or more alternative paradigms from which researchers can choose. In my opinion, research on substance use, addiction, and recovery, specifically amongst the college student population, is lacking a range of substantive foci and theoretical and methodological approaches. Understanding substance use, addiction, and recovery of college students can be enhanced by drawing on many substantive, theoretical, and methodological perspectives rather than stressing just one or two, which are currently the paradigms of clinicians and social workers. Not to assert that these are necessarily wrong, but I wonder, what if we approached collegiate recovery from a student affairs paradigm? What if we drew upon bodies of literature and student development theories, social justice in higher education, and higher educational leadership to begin addressing the collegiate aspects of collegiate recovery? What if we drew on bodies of literature popular in collegiate athletics, campus recreation, or Greek life? Revisiting my personal story at the beginning of my speech, my substance misusing identity was realized when I entered the sport of competitive bodybuilding. From there, developmental theories of self authorship and methodological inquiry of the body as a site of research propelled me into a recovery identity. Once in recovery, I became fascinated with development through sport to better understand my own movement through the substance non using, using, misusing, and recovery continuum. The takeaway here is that my support team encouraged me to conceptualize substance use, addiction, and recovery differently, as I am encouraging you to do today. If we are to take seriously the possibility that collegiate recovery has distinctive elements from addiction and recovery in adult populations, then we need to identify what those elements are and what difference they make. Similar to the argument made by Lawrence Chalop in their 2006 Ziegler lecture, merely testing the utility and limits of borrowed theories would constrain us from fully probing the collegiate recovery context for its distinctiveness. My hope is that this speech will provoke you to think outside the dominant literatures of our field and explore how the problems of collegiate recovery could be answered through paradigms in other literatures, such as higher education, a field significantly older and more developed on the collegiate aspects of the population we seek to serve with our programs. Thank you.